Hello and welcome to our presentation around monitoring auditing. Our team is going to be covering specifically hospital environment, and our project will be focused on the coding and billing process. Members of the team include Steve Albert, Karen Marie Buckley, Sylvie Hengjin, Nick Odell, and Maren Thomas. So at a high level, we will be covering a specific organization and its journey through compliance and the benefits of implementing a monitoring auditing program. We will start with the organizational background and its current compliance infrastructure, the benefits and opportunities of its current compliance program, the Office of Inspector General, OIG recommendations around coding and billing, policies and procedures. We will then delve into the compliance program and break down as far as general compliance and coding and billing specific within three specific areas: reporting and investigating, enforcement and discipline, and response and prevention. From there, we will propose what the benefits of implementing a monitoring auditing program, the associated proposal budget, and next steps. So the organization we selected is Middlecrest Hospital. A little bit of a background on Middlecrest Hospital. It's a 500-bed facility, approximately 3,100 employees. Of those 3,100, 600 are clinical. Middlecrest Hospital is also located in central Connecticut. Our current compliance infrastructure is consistent with the 7 Office of Inspector General Compliance Program recommendations. We have written policies, procedures, and standards of conduct. We have a compliance officer and compliance committee. We have training and education. We have open lines of communication. We have standards and well-publicized disciplinary guidelines. Monitoring, auditing, we do have it documented, but that's where we want to create a actual program, and that'll be part of the presentation today. And we also have a system for responding to detected offenses and developing corrective action initiatives. So we want to currently evaluate the compliance program at Middlecrest by looking at the current state, the benefits, and the opportunities. So at current state, we have to ask ourselves as an organization, is our compliance program meeting our needs? And having that feedback within the stakeholders internally and externally, and having that discussion. The benefits of the program is when the compliance program was created, it met the current business needs. Without a program, Middlecrest was exposed to a lot of compliance risks. So having a program in place identified and mitigated some organizational compliance risks. Current opportunities, just because we have all the compliance elements, some of those elements are not tested. Some of them we're finding are complacent and inefficient. And as with in any industry within healthcare is not any different. As the business environment changes, so does the compliance program must be flexible to adjust. So here's a direct quote from the Office of Inspector General around the risks involving hospitals. It calls out that one of the single biggest risk area for hospitals is around documentation with claims, requests, making sure that all the claims and requests are complete and accurate, and all necessary services are reasonable and documented appropriately. To follow up on that, the Office of Inspector General guidance recommends that policies and procedures cover communication, appropriate and timely documentation and maintenance of records. Employees must not be compensated for improperly coding, and all employees and vendors must be aware of the hospital compliance policy and program. So as we start the process of designing our new monitoring and auditing process, we want to stress our goal of having a comprehensive, transparent, and inclusive design. The process will begin with utilizing an OIG work plan as the big picture design. This is essential for providing us the framework for our monitoring and auditing focus for the year. The process must be fluid and constantly evolving as new areas of risk and vulnerability are identified. We have to ensure that we are working on our response time and how we are able to take an inquiry, a compliance inquiry, and investigate and resolve the needs as soon as possible, and that has to be the expectation. The elements within reporting and investigation we will cover in the next couple slides will be around the risk assessment, benchmarking, internal monitoring, and external audit. So before we understand where we want to go, we have to understand where we are, and that would the tool that will help us with that is a risk assessment. So our focus being around coding and billing, we would want to identify which specific areas are high risk. We want to staff and fund those high risk areas accordingly. We want to continuously monitor any special fraud alerts that come out from the Office of Inspector General, and we want to look at statistical sampling of as far as auditing for payers and medical records and case volume. And we want to maintain proper documentation on file for 6 years or until the statute of limitation is reached. Once the risk assessment has been completed, we will have the baseline figures for future benchmarking of pre- and post-policy reviews and updates. The next step would be to use that benchmark data to compare with other similar-sized hospitals in our area as well as nationally. Any outlier figures or data that is significantly different than local or national averages would be reviewed as part of the monitoring process. We need to learn why those figures are different. Is it a legitimate one-time difference, or is there a signal of potential larger systemic issues? Documentation of these results will be maintained. So within internal monitoring, we want to focus on two specific intake areas, so employee input and internal reporting and auditing. So around employee input, we want to focus on engaging the employees, specifically the ones that are doing the actual work. They're the best resources we have as far as understanding what the current workflow is and what the opportunities to improve it. Around internal reporting and auditing, we would have standardized systems and processes in place where we would monitor specifically high risk areas, ones that are not identified as high risk. We would still monitor them, but not at the same frequency as high risk areas. Lastly, we would hire an external auditing firm to come in once a year to perform a retrospective review. An external firm would allow for an unbiased, objective review of our processes. Their expertise of having done audits for other healthcare organizations and their ability to offer suggestions or best practices moving forward would be invaluable. They could also highlight areas of future risk and preventative proactive measures. Although an external firm may be an added expense, they come with a plethora of knowledge and could benefit our hospital for the upcoming year and reduce risk and exposure to compliance-related issues. So around enforcement and discipline, we want to focus on the who, the what, and the how. So the who is the oversight committee, which includes the Chief Compliance Office, Human Resources, Board of Directors. The what is ensuring the policies are followed, transparency across the organization, ensuring that the disciplinary policies are clearly written and everything is understood. The overall message is that actions of noncompliance will be subject to appropriate and proportional punishment. How we do this, we have to establish working relationships between compliance and the functional areas to ensure alignment across the organization. So specific to coding and billing, here are some common violations. Upcoding, which is billing for a more complex procedure. Unbundling is taking procedure components and separating them and charging all at a separate cost. Kitchen sink coding, which is basically adding other codes to the initial diagnosis to justify more treatments when the standard is one code per diagnosis. Having inconsistent coding, where a diagnosis is changed without the patient's symptoms being changed, allowing for more procedures and billing accordingly. Inflated charges can happen when a provider delays submitting medical bills to the insurance provider, and that often leads to inflated costs when this happens. So within our enforcement and discipline structure, some disciplinary actions that we would follow would include verbal warnings, written warnings, suspension, termination, financial penalties, which under the False Claims Act could be subject to could range from $200 to $10,000 for each item or service that payment was received or deemed fraudulent. The incarceration could range between 10 years and even as possible as 20 years, depending upon the disposition of the patient. So these are other considerations as far as disciplinary action. So around response and prevention, we have to treat every compliance inquiry as a growth and learning opportunity. We have to be able to objectively look at our data to see if we're uncovering themes as far as repeat issues. We need that cross-functional expertise across the board. We need to look at which coding and billing departments are at most risk. So we need the need for continual risk assessments, the organizational alignment, and conducting root cause analysis. And we want to look at who the best in class is. So we want to focus on the data, who the best is, and how can we best leverage that. So also within response and prevention is training, which is very essential in this process. So all departments would be monitored. We would have a system in place to identify high-risk areas. We would have a process in place if, as far as contacting them, understanding what the current state is, any root cause as to why something happened, developing countermeasures as far as training, educating, re-educating. Because we want to get to a point where this doesn't continue to happen. Training is an ongoing process, and it would be ongoing and offered in a variety of different ways. So this slide outlines an example of the financial impact to the organization without a robust monitoring, auditing, compliance program. Last year, Middlecrest reimbursed almost $26 million. Looking at the patient variety and cost, we can have range from having a complicated drug patient needing surgery, can be approximately $500,000, ranging all the way down to a healthy newborn, which is $7,000. Using the healthy newborns as an example in this, we looked at 1,100 babies were born each year with a minimum cost of $7,000 per baby. Only 795 of those claims were charged, meaning that there was a gap of 315 babies times $7,000 per child, adding up to $2.2 million of potential reimbursement. So here's just an example of the cost associated with it. So around the monitoring auditing program, around coding and billing, we want to close with these points. So the who, we're looking for a dedicated team of compliance experts with support from the whole organization. The what is a comprehensive review of the existing program and ensure its design is meant to achieve its associated goals. The how, we want a consistent review and effective training program. This process would be ongoing. We don't want this to be looked at as an annual thing and only specific to specific managers. We want this owned by all. Why do we want this? We want this for organizational awareness, and because we are asked to do more for less under greater scrutiny. So as far as the budget, we are asking for 6 additional resources, 2 compliance officers, and 4 data entry personnel. We're looking at salaries, potential bonus for the data entry people, software equipment, associated training. So the total cost for the first year would be approximately $900,000. Program costs after the first year would just be $350,000. Looking back at the example we just provided, as far as just looking at newborn babies, the $2.2 million, just in that type of patient, we feel that this is a justified expense to the organization. So recommendations and next steps. This is our proposal to you, the board. We're hoping for a review and approval. Upon approval, we will talk about the actual design and the communication plan out to the organization. What modes of communication will we look at? How frequently will the monitoring and auditing program happen? What does this look like internally and externally? We will then look at program implementation, what the expectations are as far as a timeline, you, the board, what information that we can provide to you and your expectations. And again, just looking for, in closing, just looking for organizational feedback intake, both internally and externally around our stakeholders. Thank you very much, and this concludes our presentation.